Canada is set to receive a record number of COVID-19 vaccine doses this week. More than 640,000 shots are expected to arrive from Pfizer and Moderna. In Ontario, the province says the rollout could look different in each of the 34 health units, which has opposition leaders slamming the Ford government for not being well prepared. While they must follow the Ford government's plan to vaccinate priority populations first, Ontario's 34 public health units are required to create their own distribution plans.
They have historic data on their community, on the individuals and the neighborhoods within those public health units that are more at risk.
But opposition leaders say leaving it up to public health units is already creating confusion, especially for the next phase of the rollout, those 80 and older, who still don't know where or when they can get their shots.
Doctors didn't even know that they were going to be expected to contact 80 and older folks, their patients, to let them know that the vaccine was coming.
The province says in some health units, physicians will be reaching out to their senior patients. In others, mass vaccination sites will be in place.
The government's clearly not ready.
While the province says it has now completed vaccinating long-term care residents, they are still vaccinating staff and essential caregivers. And further support announced for long-term care today, a $4.1 million investment to train 373 new personal support workers.
In regions of the province that have been hardest hit by the pandemic, such as Ottawa and the Greater Toronto Area.
Too little, too late. That was, frankly, a slap in the face to this entire sector. Unlike provinces like BC and like Quebec that hired thousands upon thousands of workers, we're now hearing that you are rushing to hire under 400 almost a year into this pandemic. Give me a break.
And there is criticism tonight that the Ford government has instead invested $2.5 million in wearable contact tracing technology, wristbands that beep or vibrate if users are less than 6 feet apart, and also alerts users if they've been in contact with anyone who has tested positive for COVID-19. Similar to the COVID Alert app, but the government says this is a solution for workplaces and settings where smartphone use is limited or prohibited, like airlines, schools, and long-term care homes.
Do you think this was a wise investment?
We look deep into anything that we invest in attracting jobs. You have to look at the long-term investment, and we felt like it was a good investment, so we moved forward on it.
I think this has been just an example of wrong priorities with this government, where we need that money to be spent, and we've said this repeatedly ad infinitum, ad nauseum, is with more trained healthcare staff.
The government tells CityNews these wristbands aren't currently being used in any schools or long-term care homes, but they are being used by companies like Air Canada and in some Indigenous communities.